Hello, everyone. My dear fellow TCM colleagues, peers, ATCMA members, students, and friends. Welcome to the first English WeChat lecture of 2020 held by the Online College of ATCMA American TCM Association in conjunction with TCM AAA, TCM American Alumni Association. Today in the U.S. Is March 15, 2020. The current local time is Eastern Standard Time 8 p.m., Central Standard Time 7 p.m., Pacific Standard Time 5 p.m., and in Beijing, China, it's March 16th, local time at 8 a.m. I'm Dr. Louis Lei Jin, a licensed acupuncturist in Milwaukee, Wisconsin, and admin for acupuncturists on WeChat and ATCMA Forum WeChat groups. And I'm your MC for the lecture tonight. Before I begin my introductions for our lecturer tonight, I want to first express my sincere gratitude for all healthcare workers, colleagues, and first responders fighting hard on the front line to the COVID-19 here in the U.S., in Wuhan, China, and elsewhere around the world, where now the deadly virus is now fast spreading. I know that we're all in some tough times right now, as no news is good news these days, but you do give us that hope, and we definitely wish to continue believing one another, support the goodness of human spirit, and we shall overcome this. And to that, I have the honor and privilege to moderate for the great speaker and expert in TCM psychology and mental disorders, Dr. Joseph Changqing Yang, tonight. Dr. Yang is a licensed acupuncturist from Los Angeles, California area. He graduated from Heilongjiang University of Chinese Medicine in 1984 and continued his study in the same university for a master's degree in the field of diagnosis and human constitution in traditional Chinese medicine. He later obtained a PhD in psychiatry and neuroscience from Kobe University in Japan. Dr. Yang has been practicing Chinese medicine in California since 2002, where now he has a private clinic while teaching in Imperial College of AOM, Yosan University of TCM, as well as he was one of my doctorate degree instructors at American Academy of Acupuncture and Medicine in Minnesota. So based on the inner classic Neijing theory, Dr. Yang proposed a series of methods and techniques called the Bensen acupuncture, Bensen herbology, Bensen conservation, and Bensen psychotherapy. And late last year, and those are now available in actual books and print forms, although they're only in Chinese for now. Today, Dr. Yang will bring a good lecture titled How to Cope with Coronavirus COVID-19 Induced Panic and Stress Reaction with Traditional Chinese Medicine. The lecture time itself is around 45 minutes with 10 to 15 minutes at end for any question and answers. Please note that when you do ask questions, write and type your English questions with your name at the end. Dr. Yang will try to answer them with voice messages. So without further ado, Dr. Yang, you may begin your lecture.
Everyone, this is Joseph Yang. Thank you for Dr. Jin. Give the warm introduction. Also have to give the appreciation for this platform. Also, I have to say thanks for our colleague and the great co-workers. Also, the great person and the people in the group and the professionals. They are still fighting in the front for the coronavirus situation. So right now we understand this is not one country, one city. This is a crisis around the world. This is a talk. I try to make some kind of the information from my personal experience, also from the current my clinic, the certain situation and examples. So I do believe after this period we have more experience accumulated, and I believe the TCM will be more effective to benefit to any epidemic situation. So today's talk we call it How to Cope with the Coronavirus, Introduced Panic and Stress Reaction in TCM. So just follow the slides. As you know, under this kind of unprecedented, this kind of situation, we have one very common the situation in the DSM diagnosis we call the acute stress reaction. So this is the psychological condition that can develop after exposure and as response to a stressful events. So how about the coronavirus? Yes. We still remember the Wuhan city was under a tremendous pressure. Also, people experienced the panic period time. Also, right now, they're experiencing anxiety, depression, even we called so many emotional trauma based. Now it's USA, where start panicking and under such anxiety and a stressful situation. So for the acute stress disorder, that's the DSM code 308.3. So directly experiencing the traumatic events. So witnessing in person the events as they occurred to others, learning that the traumatic events occurred to a close family member or close friends. Note, in case of the actor of threatened by death of a family member or friends, the events must have been violent or accidental. So how about the coronavirus? Yes, the most worst situation happened in Wuhan. So many citizens experienced the very, very traumatic the events. So the family member hospitalized in a severe condition, or someone lost parents, lost the loved ones, and lost their children. So even I don't think the same situation will happen in USA, but from the current, the virus still is under spreading, and the people feel some kind of panicky. From the current, the people accumulated some kind of the food, drinks, or some of the daily stuff. And we know this kind of panicky is ongoing. But clearly, the situation is manageable. So how to manage the situation? So let's continue to talking about intruding symptoms that regarding this kind of acute stress situation. At the slides, you can see the memories of the traumatic events. So after we experiencing something, we always remember something in the past, we think something very negative and pessimistic. That's kind of the human nature. Also, distressing dreams related to the events. So this kind of situation happens. Some of the people had or may have some kind of the sleeping disturbance with distressing the dreams, also have negative the dreams and like a nightmare, and frequently waking up and think about what's going on, and concern the self maybe getting infected, or maybe losing someone's, even develop called the illusional thought and the thinking. And continue to have these dissociative reactions. So think everything is not real. Then they're detached. And I don't think the world surround them is very vivid, it's like true, but with a dissociated, this kind of reaction, that's the very tremendous stress cost. Intense or prolonged psychological distress or marked psychological reactions. So this is very disturbing the people psychologically, can burn the people out and causing a lot of situation, memory, sleep, fatigue, energy, and normal functioning like social and extra. So that's a very disturbing situation. Also can develop many physical symptoms beside the psychological situation. So think about the people under the coronavirus attacks. Absolutely. they have very negative memories and they associate with the negative emotions. And they have very distressing dreams, and it may be hard to fall asleep every night. And someone may have dissociative reactions and feel numb. So traditionally we have the terms. That's why I use the shenqi numbness to try to describe under the tremendous stress, people have dissociative reactions and less or non-emotional response. So that's very stressful. And DSM also talking about the negative mood-based, like a persistent inability to experience positive emotions. Actually, when people are under a certain stress situation, right now, even we are living in the USA, we're staying in the USA, we fully understand under current virus, the threatening. We couldn't enjoy the food. We couldn't enjoy the relationship. We couldn't feel so happy like as before. So far, we can manage something. If the virus situation gets intense, we may have more inability to enjoy our lives. That's the current situation. So any emergency, especially this kind of the epidemic, right now called a pandemic situation, so this kind of the negative mood can be very severe, also had strong infections. So under this acute stress emotion action, so people commonly will experiencing fear, anxiety, and panic, confusion, and feel loneliness and depression. So this is a very common reaction from the acute stress. So currently, everyone feels certain fear, anxiety, and someone already started panic, and someone a little bit losing control, and then someone feel lonely, feel helplessness and hopelessness, and feel some kind of desperation. So the depression can be started. So people has their own personality and how to handle stress, and then with their internal, we call the mental energy, that's the shenqi, the reaction pattern to cope with the current situation. So the symptoms can be worry. So basically, the major, we call the main mental disorders, can be seen like anxiety, depression, insomnia, PTSD, and so on. Not limited to the four. For example, the adjustment disorder, memory loss, and etc. So anyway, we have to know, under this kind of stressful situation, the human has emotional and psychological reaction in a negative way. In the pathological reactions is a kind of normal situation. So as a professional, how to respond, how to helping people to manage and ameliorate, minimize this kind of condition is our current acute tasks. According to the professional talking, basically, under this kind of epidemic situations, almost 1/3 to half of the populations will experiencing in certain disorders. If plus we have temporary or called transient, short-term, the emotion and the psychological stress reactions, almost everyone have certain degree this kind of mental reaction. And they have certain emotional, stressful experience and feelings. But anyway, based on the personal, the psychological capacity, so people has different reaction patterns to cope with this kind of situation, especially the acute stress condition. If the people feel in stress after the panic, or maybe frequently happens on the way, so the chronic stress reaction, we can easily see the easily getting anger. So when you see in the shopping center, not like before, the people easily order, they grab something they want. Then they get angry easily. maybe in the parking lot, or you see someone disturbed the general order. Also, people easily refuse to cooperate and is suspicious on the authorities or on the professionals. Even think there nothing can be helpful and nothing can be trusted. So that's a very common situation that happens under stressful situation, give this kind of reaction with emotions. Also, people have the hopelessness and the negative thoughts. Always think something worse and less hope. So, based on the personal internal energy, someone even think about these kind of negative things may affect themselves, family member. They couldn't fall asleep, couldn't concentrate it. And because no concentration and the memory got it somewhat degree disturbed, they easily causing some kind of from the minor accident and until they cause big troubles. Anyway, so that's the chronic stress reaction as well. Right now in the USA, we start panicking, and shortly after, we should experiencing such chronic stress reaction. And you see the people with some emotions as well. And also people show their moodiness and easily make an argument. So I saw some of the argument regarding this kind of regarding wives, regarding certain topic, social topic, economic topic, and with their strong emotions. So this indicates all this kind of argument is the human, the chronic stress reaction, and it continue accumulating. So that's something we have to pay attention. Also, on extreme, we have the people, they have impulsive behavior, and are more violent, and losing the control. So that's, as a society, we have to pay more attention. So I know someone has a fear. They try to buy the gun or buy something to protect themselves and their family. But overall, the American society still. So what's the physical symptoms in general? We call the somatization symptoms. So very common, we call the palpitations and the difficult breathing. So that's the heart and the lung reactions in common. Also, we have shakes and the numbness. So in our medicine, we know that's the liver wind and the internal chi energy shaked. And we feel hopelessness and tired. So we have lazy feeling. And because of stress and overthinking, concerned, so we have lower appetite and less desire right now. And some of the people can develop certain aching and soreness. Because this is the viral situation, people have to maintain themselves inside homes. So there are less exercise, so they easily develop body aching and body soreness. So based on the TCM concept, the emotion, basically we call it frightening, under the sudden happening without prediction. So this is from the outside, the fear from the internal, because with their own expectations, think everything's negative, the catastrophic feeling. That means the heaven going to fall, that kind of feeling. So that's very common. In the ancient times, we know that Jin Yuan dynasty, we have 4 Greek masters. One of them is Zhang Congzhen. In his book called Ru Men Shiqin, the intelligent people to serve loved ones. This book talking about the frightening is yang pattern. Why yang pattern? Because from outside. And it goes to inside, depends the people how to perceive it. So the fear is the in pattern because it comes from the inside. So that's the Greek explanation described the frightening and the fear where it starts and what's the energy movement pattern. So frightening is unpredicted and the fear is predictable, but both hard to control. So this is the Ming Dynasty, the Zhang Jingyue, the type means Zhang Congzhen. Also, the Rumen Shiqin mentioned, like Neijing, the Ju Tong Lun, in numbing pain discussion. So because in our medicine, the qi is the root. So when you have fattening, they cause the qi confusion. And the shen has nowhere to return. The thoughts nowhere to anchor. This kind of condition. So the qi is confused. We understand under current situation, why surprising and frightening, causing the qi messes and directly disturb our neurological system, immune system, endocrine system. So that's directly leading to the bad consequences. So that's why people even lost their life or make a situation worse, because the qi is confusion. So the Rumen Shiqin frightening has two situations. So frightening is caused by illness. So we know when the body has trouble, they can cause him easily get frightened. But also the illness caused by frightening. So the Asian people, they understand emotion also can cause some kind of physical body disharmony. So we know that's the Zangfu pattern. But also we have mental pattern. So Shen and the Jing, also called the Xing, affect each other because the root is qi. So in the TCM, the psychology, the psychiatry, we know we have body is essence, we have Xing is flesh, is essence. So because the root is qi, so the Shen, the mental energy, Shen qi, can affect physical qi, the Jing qi. Reversely, the Jing qi, the body type energy, can affect mental energy, the Shen qi. So that's why we have somatization from the psychological trouble causing the physical symptoms, but also we have physical situation disorders also happens in the mental manifestations. So that's from the qi transformation theory. So this concept is very, very important. This laid on the ground for our medicine, how to handle any disorders, diseases in the clinic. We have know the Xing Shen theory. That means mind and the body come into oneness, the theory. It's very important to handle any mental, any physical disorder in our clinic practice. Also, we know if people start panicking, the panic basically is our mental energy not stabilizing, but also scattered. It goes everywhere. You're not centered. You cannot make any decision. You just feel startled and panicky, very severe anxiety, and hope to get help right away. Even someone runs to the hospital to check with the doctor for everything. That's like when the wife started and talking about the people can transmit to the people, and many people, hundreds, thousands of people rush into the hospital in the same time, and they're talking about what happened to me, and do I have the virus infections? So that's the very typical Shen Qi scattering pattern in our medicine. In the severe, the patterns. Also, we have called anxiety. Anxiety is a general, unsettled feeling. So the mental energy, not so stable, not settled. So they have moodiness. And then moving around, but that doesn't know what's making meaningful actions. And they're not really sure, but do everything with emotion, with anxious feeling. So the mental energy is kind of an irritable feeling. We call it Shen Qi irritability. So this is also very important category in our medicine for the diagnosis. Anxiety is very common, the condition in our medicine called Shen Qi irritability. When people feel hopelessness, and they also feel fatigue, exhausted, so that's called mental energy also exhausted, we know the Shen qi, the mental energy, is weak. So we call it shen qi weakness. Also, it's a very common situation. So regarding the TCM treatment, so the first slides, I want to talk a little bit the qi hua theory, the qi transformation theory. When we treat this kind of disorder, the first, I have mentioned it before. The first, this is the yi qi, the wen yi theory. So we have to know the natural yun qi environment, what's going on. So in the Wuhan city, in the Hubei, it's different from another northern city, like my hometown, and different from the USA, like Southern California. Northern California and Southern California, it is so different. And the Southern California is more different than the Northern right now. They continue the bad situation going, like Washington State. That's the yun qi environment. Number two, also have to understand our personal, the internal qi transformation mechanisms. So as a human being, we have our own constitution. So you are a dryness type, you are a yin weakness type, you are easily qi energy stagnation type, you are toward yang heat type, or you're toward yang deficiency weakness type. So when you have any evil qi attacks, so your body has different reactions. So that's number three. We call the pattern transform accordingly. So this is a very important concept in TCM. So we know on the environment, we have yun hua, the yun qi. On the person, we have personal qi hua, the qi transformation. Then we have the disorders, disease. So that's why the majority of the person, the people, they show the certain patterns, like cold damp or damp heat. But when the yun hua, the yun qi changes, they can change our body in a certain way. But also when you have different constitution, you see the person, they may have different situation, different patterns. So at least in the Zhang Fu pattern, you know this. So this is a very new concept. So regarding our mental disorder as well, the majority of the people, they have certain situation they can handle, they can manage stress, they can spend the time and do the effort to maintain life in every detail in order. But unfortunately, that's not for everybody the same case. We still hear some of the bad information, they're getting worse, panic, even terminate their life. In the traditional medicine, we handle the mental disorder as men, as our profession working right now. So I'm using the treatment methods to handle the mental disorder. Because Ben Shen, as I mentioned many times before, it comes from the Neijing, the Lingshu chapter 8, Ben Shen. So I have the 4 methods to share with you, called Ben Shen acupuncture, Ben Shen herbology, Ben Shen psychology, and the Ben Shen conservation. So let me explain to you for the current situation one by one. For the general anxiety, in general we call it Shen Qi irritability. So basically, we have to calm down the patients, the emotion, unsettled, the moody feeling. So I gave the quick needles, they call it 224, GB13. So people know the 224 is Ben Shen, the Shenting, the GB13 is Ben Shen. So these 3 points are frequently used in our clinic to manage the Shen. But you have to know, you have to let the patient to feel calming feeling, to guiding the Shen, work with your hands, to give the sedating feeling, to let the patient focusing to move the Shen Qi to the current, the points, and the sedating. So the 224, even this one needle, can make big changes. Also the lung 7, regulate the breathing. Many anxiety patients has the wrong or irregular the respiratory rhythm, the lung functioning get changed. Not like kids, the adults, in a certain way, you can feel the breathing is changing. Irregular, short breaths, feel the chest pressure, and then later maybe complaining they have difficult breathing. So this is lung 7. Make a good combination with the 224 and the GB13. Spleen 6 is regulate the 3 lower in organs. Also, you can let the patient focus on this point to descend the mental energy down. Lever 3 to regulate general qi as one gates to move the qi. Heart 6 is cleft qi points to open the heart qi men to reduce internal stagnation. For depression patients, I prefer the 220 and the 224. 220 are the key points. You have to do the lifting, to lift the shen qi, to let the patients feel energy rising. And the 224, as the common techniques, also do tonifying or even needle to give stimulation. Ren 6 to tonifying, give the qi back. Heart 7 to close door gently to let the heart qi, mental qi, back inside to support the shen qi accumulating. Kidney 9 also can stabilize the shen through the nourishing-based treatment. For insomnia, we have Yin Tang, Heart 7. Based on the deficiency excess, shen qi rising or descending, you can add your techniques. Just follow the same style I mentioned above. Spleen 6, kidney 6 is very common used for sleep disorder, insomnia. But if you didn't know, you have the tonifying, you have steadying, so possibly not so effective. So look at the patient, look at the age and the time. In the acupuncture books, why it is so important you have to know the people deficiency excess. The reason is right here. Why you have to let people under your guiding, you can move the shen towards the points, because that's regarding how to regulate the shen to guide the mental energy in a certain direction and remedy the mental energy back to normal. So the spleen 1 is very good for insomnia with the dream disturbed sleep. So spleen 1 is very descending to calm down the dreams, settle the emotions. For panic disorders, I use the PC4, Heart 6. So PC4 we know that work to the internal and soothe the internal feeling, internal organs. You can use the PC6, but the PC4 can play the role as well. Heart 6 is the qi points, quickly settle down the people. 224, sedating, calm down the mental energy. Heart 8, quick breaking to make the shen back to their room. We call it shen returning its room. Also the Ren 20, this point is easy to reach on the upper chest to settle the chest full feeling. So you have to do descending. So for panicky people, in general, it's hard to do all the points. You just select the first one, for example, 224 or PC6 to start your treatment. If patient hard to tolerate, you have put in the needle right away. You don't have to remain the needle all the time in the body. That's for the panic disorder. If start treatment, the patient feel panicky, you have to remove the needle right away and train the patients, give the instructions to let people how to do the breathing and settle down the emotion. After resting and wait until next time, come back. So this is called Benshen acupuncture. I have frequently used in my clinic and used in the schools under my supervising. Anyway, Benshen acupuncture has more and more conditions, but today I give this simple explanation for this kind of simple acupuncture combinations. Now let me talk about Benshen or biology. So right now, they follow the coronavirus, COVID-19. In China, the nation, from national level until the general doctors, they use many formulas. So overall, we know the Chinese medicine in herbology is very effective. So many light symptoms or moderate symptoms, even some of the severe cases, under manageable and cured. So we're so happy to hear this news. So as prevention, I gave the very simple ideas just for your reference. So for some excessive tight body, we give Fang-Feng-Teng-Sheng to modify. For deficiency body, we give Ren-Shen-Bai-Du-San to modify. For the heat attack type, we know they should be like winter heat feeling, red face, red eyes, feel fever. That's the Yin-Qiao-San. Only feel some kind of irritated throat, we give Sang-Ji-Yin. We have heavy head, foggy, so we give Qiang-Huo Sheng-Shi Tang. We have dry throat, thirsty, we give Sha-Shen Man-Man Dong Tang. So all these kind of formulas are classic formula, also very good for English speakers to pick them up. Also, all the formulas I picked up here, basically, you are easily to find your patent formula in your clinic, also in the major maker in the USA. And also for the treatment, I make some formulas here too. So the first formula, for example, I use Huangqin, Shigao, Binglang, Houpo, Caoguo, Ganzao. So when you read this formula right away, that's the Wenyi Lun, Wuke Dayuan Yin. Because there is Huangqin in this formula, I use Huangqin pull up as a king herb, so you can increase dose. For example, you can do 25 to 30 grams, even more. So with this kind of the Binglang, Houpo, Caoguo, anti-Wenyi herbs, so this directly treat the lung, and with the Shigao, they treat the lung heat. That's for severe situation. The second one, Ma Huang, Bai Guo, Fuling Pi, Xixin Ganzao. This one for asthma with the difficult breathing, also with the cumulative flame based. It open the lung right. Number 3 is Huangqi, Baizhu, Banxia, Shengjiang, Ganzao. So this one boosts the qi, also transform the damp. So based on the current, the COVID-19 happening in Wuhan, I think the dampness is the top, the major evil qi. So we have the Huangqi to boost the qi. Meanwhile, use Baizhu, Banxia, Shengjiang to transform the flame. Number 4, we have Jingyinhua, Huoxiang, Chaihu, Qinghao, Daqingye to release this kind of extra evil qi, transforming the evil qi out quickly. So this is called light transforming type formula. And continue number 5, we use Huangqin, Zhishi, Gualou, Baijiezi, Sangbaipi with Ganzao. This one for concentrated working on the lung heat, flame heat accumulating. So from the CT scan, the people mentioned that's kind of mass for pneumonia type, the accumulating in the lung bottom. So can use this formula, try to transform the flame outside the body. The last one, the Houpo, Caoguo, Roudoukou, Cangzhu, Wuweizi. This one for the qi deficiency with the diarrhea based. So this formula good for the cold damp or qi deficiency, lung qi, spleen qi, but with the diarrhea. So we have this formula to boost the qi and binding the diarrhea, the leaking. So overall, the 6 formulas can cover the majority of the cases in the COVID-19 virus attacks, the pathological conditions. In the clinic, we have to use our Benshen psychology to take care of the people. I'm happy to hear the many doctors in the front line, they mentioned they used certain techniques to communicate with the patients. So that's very important. As we know, even in the Su Wen the chapter, we know the Tang Yi Lao Li Lun, they're talking about the decoctions, discussion on the decoction, the herbal decoctions. They're talking about the Shen Bu Shi, if a patient psychologically not responds well, we know our treatment can be largely discounted. So now we know. So we use the 4 major techniques in our clinic. Here we call it warning, the go. The warning means when patient something wrong, we have to give a direct the warning to let the patient stop. So this is basically talking about how to use a warning to stop the certain wrong behavior and to let the patient know the consequences if they continue the certain behavior and something else. So this is very this kind of restrict the treatment style. The second is talking. This one is our frequently used in the clinic. Basically, many people with some anxiety and depression, they feel hopelessness and they feel depressed. So talking is to support, to warm their heart, to give them support, to let them understand everything will be over. The situation should be getting better. So with the positive talking, they can increase their the compliance in the clinic, also increase the treatment effectiveness. Also next is called guiding. The guiding is leading the mental energy, leading the patients to follow their personal, the energy pattern and transform it to the positive way. For example, we have many people very active, but during this virus situation, they have to stay home. They have to stay inside. They couldn't do any exercise. So I have to find a way to do any simple exercise at home. Keep the body movement. Even watch the certain on the YouTube, they have someone give the tour guiding the family member in the rooms, or make jokes, or share some kind of the very interesting topics, or even watch TV, watch certain the positive, or watch the certain comedy-based programs. So that's a good thing. Anyway, we have guiding people towards the. So working with the patients, we have to know how to lead in guiding the patient's energy towards positive direction. We never give up as a doctor. We never give the negative thoughts or give the negative leading. We always give patient hope and guiding the patients towards the positive the direction. So that can make things better. Also, last one called opening. Opening means open the suffering. So let the patients to complaining and to talk, to share their suffering, to share their feeling. So as a doctor, we have the ear to listen patiently. So that's why we call listening is healing. When patient complaining, we know the story, we know their suffering. After complaining, the majority of patients, they feel big relief because they know that this is the Shen energy, mental energy communication. So that's why Shen Qi is so important. But also we have to understand the timing and the techniques. All the mental, the psychological treatment skills. If we did the wrong timing, or we don't know the techniques, we don't know how to talk, how to share, we may cause some trouble. But anyway, as doctor, we observe the patients, and the patient puts a strong trust on the doctor. So we know we have the good timing. Also, we know the techniques in certain way, and we can do all these kind of types of the treatment, the techniques, and then let the patient feel better. So that's why I don't feel this kind of technique are the very difficult techniques. So you can do easily implementing this kind of techniques in your own clinic. Now we have to start this. Now let me continue the talking about the Ben Shen conservation. This is the mental exercise. So based on the personal situation, also your personal life condition. I give 4. The total has 10, but I give 4 right here. So because we have 3 groups here. I have 3 groups I wrote in my book. The first group 10 is outdoor based. So not good in the Wuhan situation. But now let me start the second group to talking about the first one called support heaven and lift Shen. So this one basically is better do it at the morning and morning time. to find a quiet place. So if we don't have outdoor the condition, we can stay inside. And this kind of style is good for our mental energy very low and sluggish. And the effective is lifting the Shen Qi and rising the yang energy and strengthening the heart and the body. So after enter the position, we have started this kind of exercise. Basically, let me talk on this exercise style in detail. So we have to make the face toward the sun rising direction. And you can standing or sitting and make the body very stable. Put the both hands on the lower dantian place. After breathing, quiet down. Gradually close the eyes. When you're breathing in, you can move the two hands, the palm up from the both sides of the body, gradually lifting up and above the head, and slightly make a head up and raise the chest. And the both hands you can make a little bit the movement stay on the top hand. You can hold the breath for a little bit movement. Then make exhalation, breathing out. Meanwhile, the palm towards down from the both sides of the body and back to your lower abdomen, we call the dantian location. So this exercise can move the qi around. You have to pay attention. Let your mental energy Shen Qi follow your palm up and down to do the same exercise. So based on the personal constitution and the real situation, you can do 25 each time or 50 times, continue for months or for a week. You'll feel the difference. The second one we call come to the earth and anchor the Shen. So this one is better to the afternoon or evening time. So it's better for the certain people with overexcited, sensibility, anxiety, or busy mind, or insomnia with a busy mind type person, because effectively is try to calm the heart and stabilize the Shen. So if no outdoor, you can stay inside. Same as first one, you can make it standing or sitting. Put your both hands on the lower abdomen, the dantian location, and start breathing. When you start breathing, meanwhile, the both eyes close slightly, and when you're breathing in, you can move your both hands up and palm down, goes top, no any break, no stay, and directly come down. So both palms towards down, and slowly move down to dantian, and breathing out. When you're breathing out, try your best to breathe out all the air, then do the next. So overall, you feel breathing out is more, breathing in is less. When you do this movement, you have to pay attention on your both hands. So the same style, you can do each session 25 to 50 times. Normally it requires 3 months, but under this virus situation, you can do 1 week to 2 weeks. You should feel the difference. The third one called the safe hugging and protect Shen type. This one is much easier. And you can go to some private location to do it. So this is good for the Shen Qi, the stagnation, the emotion is down. Also feel nothing helpful or stressful situation. So basically, when you find the location, you use the self as the center. You have 4 directions. And it's better to do the standing position. The sitting is okay. So you can start from the face toward the east to start. So from the regulate breathing and calm down the emotion, the shen, then use the hands to hold the ball and move towards your front chest. And move down the eyelid and gradually regulate breathing. And let the breathing enter the ball you're holding in the front chest. Then, if in the outdoor, you can open the eyes to watch far away the scene, like trees, mountain. So, let the qi move outside. If inside the rooms, you watch the wall, the painting, or window to let the qi to dispersing. So you can do 25. Then, one direction you do 25 times or 50 times. Then you move to the south, west, north. Then continue until finish all directions. So this, you can do the exercise same, like 1 or 2 weeks. You'll feel the difference. Number 4. And this one called 转身回旋法, turn the body and recover shen style. On my slides, I did a safe hugging based. Let me talk in the hugging. So hugging is standing. You can use both hands crossed on the chest and holding your chest and regulate your breathing. If you hold too tight, your breathing will be difficult. Hold tightly, but properly, you can make your breathing working. Then, watch outside or watch far away, or close eyes to feel yourself hugging. So this one can quickly calm down emotion and get yourself support and strengthen your shen qi. This one for general stress reaction and hard to make a communication and feel lonely. So this is the safe hugging based. We call it 自我抱神法. Also have one called the 音声和声法, the making sounds and harmonize the shen. So basically you can make sounds. We follow the 5 elements based. So use the regulate gan qi, liver qi type, called the hu. Even based on the different theory practice, I prefer the hu, which like use the mouth style like hu, and use ho, these words to express the liver qi. And use the laughing, the happiness, to make the heart qi recovery, enjoy the emotion. And use the ho, the harmonize this kind of sounds, the voice to harmonize spleen. And you can use the like weeping or crying to read. Also you can use the growing. The low and the deep the tone to release the qi. So that's good for regulating our emotion and shen. So this kind of exercise is better to follow the professional's instruction. But at least I introduced the top of the 4 you can keep doing for this kind of regulation. Also on the next slides, had to be faster, called read aloud and connection. So you can read the poem or certain chapters, make a loud voice, can treat your shen and regular shen energy. We have ancient, like Man Jianhong, the Yue Fei, the poem. Also we have certain chapters like Yue Yang Lou Ji, etc. for you to regulate the shen. And the second one called reading in silence and concentrated. So you can repeat a certain sentence and words or classics. For example, we call it 恬淡虚无真气从之. For example, so you can read say, if I keep my quiet, we keep everything calm down, I can make my true energy to follow me. So you can use the words silent reading. The number 3 we call it reset and stabilize the shen. So repeat the same words. When you feel panicky, you just repeat say, don't worry, nothing urgent. Don't be panicky. Don't be emotional. So repeat. You should feel something different. You should calming down yourself in just a moment. The last one, we call it. And sorry, I passed the time for several minutes. And I'm so appreciative for this kind of platform. We can give the general talks regarding the traditional medicine, especially the traditional Chinese medicine, how to handle this kind of acute situation under this kind of viral attacks. We know all the world people right now still under the tremendous pressure, and this kind of tremendous emotional waves can affect everyone in the world. We have to be prepared. So let the TCM to play the role. Let the people help each other. We have to unite together to use this kind of traditional wisdom and use our current, what we have, to helping people. Thank you very much. My talk is finished here. Thank you, Dr. Jin. I return to you.
Thank you, Dr. Yang, for your excellent lecture. We learned a lot about how to cope in this stressful time of COVID-19 to regulate our sin through your proposed protocols and the way of traditional Chinese medicine. Let me see if we can get some slides shared here as well, so others can enjoy your work. And now we're kind of entering this final phase of the lecture. We have maybe 10 minutes for anyone to have questions. They can write up a little bit of text and then give it to me or post the group for Dr. Yang to answer through WeChat. Thank you. Okay, Dr. Yang is very busy, so he has to leave for another meeting. So if you have any questions after reviewing the slides, which I already forwarded here, you can leave your questions here, and then Dr. Yang, when he has a chance, he can answer those through voice or text later. Thank you for your attention. This concludes our WeChat lecture tonight. Have a great night or day, and stay safe, everyone. Goodbye.